Hi, it's Dr. Centeno, and today we're going to talk about facet cyst treatment. First thing is, what is a facet joint? A facet joint is basically the joints that live in the back of the spine. There's one right here, there's one right there, and we're looking at the spine here from the back. This is the disc in the front. This is the disc in the front. So again, it's the joints in the back of the spine. And when those joints get arthritic, they can get swollen and produce a cyst, which is right over here, and that can put pressure on some of the nerves. Now, this is a right L4-5 facet cyst, and this is the patient's MRI who I'm going to show you here. And you can see here that this is the facet joint, and we're looking top down. This is the actual joint line of the facet joint, and then this is the facet cyst that shouldn't be there. Now, this is the top-down view on the left, and on the right, we're looking at the side view or the sagittal view, and that's the facet cyst right there. So here we can see that I'm injecting actually into the facet joint, and it's going to the facet cyst. So all of this here is the contrast in the facet joint, and then off to the left here is the facet cyst itself, and that shouldn't be there. So now here you can see some interesting things here. You can see my needle, my second needle, which is going into the facet cyst itself, and you can still see my first needle that's going into the facet joint that lives over here. So here's where it gets really interesting. You're going to see me inject on the left here where it says needle in the facet joint, and it's going to come out on the right where it says needle in facet cyst in central canal. So I'm going to inject here on the left into the facet joint, and you can see it pour out in just a second here off on the right. See that fluid coming out? So the fluid going in on the left and the facet joint is coming right out, the needle in the facet cyst that's in the central canal. As far as treatment is concerned, facet cysts can be popped with an injection, injected with steroid, injected with PRP or stem cells, or surgically excised. Now, one of the issues is injected with steroid can harm and damage the joint, so we generally don't do that. Pop with an injection can sometimes work. Injected with PRP or stem cells can also have an effect. And surgically excised is one option, but it's one option that I would probably save for the very last because you're going to damage some muscles that stabilize the area getting to this spot. So thanks so much for watching and have a great day, and see regenetics.com for more information.